up as you bring it up there in Argyle. I remember how hard I worked with so many young men, and only one of them is alive for today.
Yep.
His name is Lord Melville. Pale. Everybody else died. Died from overdose, and the majority of them died from AIDS.
Yes, because with that comes the sexual promiscuity. Because again, right, you're serving a pleasure center.
Coco today, my daughter speaking, and she just evoked something in me. That one day I was in my house, and a gentleman, the same Lloyd, was eating at my big table. I laid a table for a juggling, a cracker. And my brother Norbert came in and he called me. He said, "What are you doing with him inside there? I hear you saying that you helping him and he doing better. Girl, don't let me come back here and meet him. You feeding me inside." Even my brother Norbert, who wasn't a crackhead, dead. Lloyd Melville is still alive.
Yeah, no, in some ways, Uncle Norbert was right, because we have to be grateful we survived this, Coco, and you hear me talk about these things.
I'm telling you.
Yeah, because the truth is, as a community, you can't just take it upon yourself to think you can save people in crisis like this. And you have to be mindful of your own children. And thankfully, we came out of it okay. But, this is where we do see some of those horrible stories later on, right? About what happens within the household, the trauma, the violence, the rape, or everybody getting murdered if the person decides, okay, I need to get from you. Huh?
When you're too nice to them and bring them in.
I mean, we had one who actually robbed us. Let's not forget, right? He came in at like 3 a.m. I was up studying, and I saw him because at first I thought it was my uncle. I thought it was a twin brother. And he came in and he robbed us.
He didn't know the value of US. So he left the US and he took.
Not just that he didn't know, he was really just looking for cash to go buy drugs. And so he picked up the TT from the cash register, because that was going to be his quickest way to get the drugs, right? The quickest, easiest, most straightforward exchange, But I don't want to hog the thing. I just want to explain first and foremost that, so in terms of stats, we think somewhere between 2 to 3% of a population struggles with bipolar. We think somewhere around 1 to 2% of population struggle with schizophrenia. Now, those numbers, why am I saying we think? Because people will be like, it's not think, it's in textbooks. The truth is that textbooks were written for white populations. They really were not studied in Black communities, Asian communities. And that's in part because a lot of the things, first and foremost, instead of asking about, Jamila said the crack pandemic affected everyone all over the world. Yes. But here's the thing, right? Crack was not seen as a pandemic, whereas the opiate abuse is seen as an epidemic, a health issue, right?
Because of who?
Who is impacted?
Who take the crack?
And exactly, that's what we're watching around the world. I mean, God forbid, we're watching DMX right now, possibly in a vegetative state, because of a chronic issue with abuse, and he's been very open about his journey.
Yes.
Unfortunately, though, there are many people in the Black community who have already been seeing comments around the world. Instead of feeling sorry for someone with a health issue,
yes.
What they're writing is, I can't believe he has all this and these guys are just squandering. But the truth is, mental health doesn't discriminate. Mental health issues doesn't discriminate based on money. It doesn't discriminate based on gender. It doesn't discriminate based on race, geographic location. Yet we know in Black communities, I mean, Oprah had done an amazing interview once where she shared what was happening with her school in South Africa. And she'd been called by some members of the school, some students and teachers. And they said, this one girl, she's struggling with depression really badly. And they said, Oprah, you need to talk to her. So Oprah talked to her via whatever their communication was, and the girl said, I'm fine. She then went to her. Oprah traveled to them, and she sat down with her, and she said, they told me what's going on with you. I'm looking at you, and I've brought some experts, and they too have looked at you, and we think you're struggling with depression. And Oprah said, the young lady said to her, I'm African. We don't get depressed, And that's the true thing, though, right? That is a belief. I have patients who've come with me who suffer from a very special type of depression and mania that you can see around menstrual cycle, known as PMDD, which is perimenstrual dysphoric disorder. We used to call it PMS.
I know you're taking over the whole show, but
right? I'm trying not to, because I do show
this is good. This is good. Keep on. You
have to explain this period thing, because a lot of parents doesn't understand because they didn't go through it.
The thing is, they did go through it. They just were told it was normal. Because the truth is, we normalize a lot of the issues surrounding period. We've normalized the pain of period. In fact, we tell people.
Some people may not understand what you're saying. Same menstruation, monthlies, period.
When aunt flow comes, when your friend comes every month, that's periods, right? So we used to call it PMS. And I think a lot of people probably still think it's PMS, but we no longer use the word PMS.
I think it was so serious.
Yeah, so we no longer call it PMS. We actually call it PMDD, which is premenstrual dysphoric disorder. And the truth is, some people, they can be crippled for 2 weeks out of every month. They're crying. Wow. They're sad. They don't feel like living. Their work suffers. They can't even bring themselves really to go out there and do work. For others, for about 5 days before their period, they go into pure insomnia. They don't feel sleepy. They don't need sleep. And in fact, they're just the most productive they ever are around that time. Right? And for a lot of these patients, we actually have to give them low doses of antidepressants to help them sort of mitigate what's happening there so that they can act. Because here's the thing, right? If you don't sleep.
Dr. Duke,
yes.
As the eldest person here, I believe here today, I used to hear parents and adults say, just make a baby and everything will be good.
Right. That's not true. In fact, if somebody has PMDD, if somebody has depression, bipolar, schizophrenia, they're at much higher likelihood, especially because a lot of people think they have to come off their medicines once they're pregnant. Many times, the medicine you're on is safe for your baby, but it's especially safe for you. And the way I talk to my patients is, first and foremost, healthy mom, healthy baby. And so health means mental health, right? If you're mentally unwell, your pregnancy is at risk. If you're mentally unwell, your success of your pregnancy, the success of bonding with your baby after birth is at risk. I've literally had patients who, as part of what's going on with their psychotic episodes, so psychosis and mania are different things. So psychosis is what we see with things like schizophrenia. Psychosis is where you can literally come up with a completely different altered state and mentality. You see things differently, you hear things, you talk to things and people. Like you can have a completely altered reality. That's psychosis, right?
You said talk to people. There is no one there but you having a conversation.
Yes, and it's fixed. It's not like, oh, I can just come in and tell you snap out of it. Psychosis is different. So with psychosis, someone can deliver a baby and believe they just delivered an alien that should have never been a part of them and never see that child as their own. They can literally feel disconnected from that child. Now, if that were to happen in our community, people would say somebody did obia, some old woman had watched the belly and tell she that then go this, and we wouldn't actually get the help the person needs. We may have depression, and we've actually just expanded postpartum depression. We used to say postpartum was up to 6 months post delivery. Now we say postpartum goes out 2 years post delivery, right? Because it really can take that long. And you can have. I've had patients. I had one patient come into my office. This was at this point about 10 years ago, and she brought the baby in because she was pretty sure she would kill her baby.
Wow.
And she came in crying. And let me explain the pain that a new mom is feeling, that she keeps hearing a voice telling her, kill it. But she loves her baby. She wants her baby, right? Now, people might hear that and say, oh, it's something sick within her. No, she needed help and we got her the help. right? But you have to have people aware of that sort of thing. So for example, if she's saying that in the house, she's saying that in the neighborhood, you don't just take her baby away from her and leave her there to continue struggling with what she's hearing in her head. You address it. You get her the help she needs as a community.
When I was living in Brooklyn, one day, one of our young cousins, she had a baby, and she called me and she was just crying and said she don't know what to do. I said, I know what you should do. Bring me that baby and you go out and enjoy your weekend. You know, all crying up, everything end. I took the child by me and I said, sometimes mothers need a break from the child that they just bring into the world. They don't want to see the baby. They don't know how to handle that baby. They don't know, you know, you give the baby food, the baby's still crying. Most people can't handle that.
There's that, but there's also the sense of helplessness. In the past, we really took childbearing and birthing as a community effort. Nowadays, birthing is very singular, right? A lot of people, they birth the baby and you send them home. You send them home. And somehow she's supposed to know what to do with a newborn, know how to sleep with a newborn, how to ensure that a baby sleeps or that you sleep when the baby sleeps. You know, we actually have to go back to that sort of village health.
And early education.
Yes, how the village helps you raise your child in the beginning, right? I remember as a little girl, I certainly heard you talk about, you know, Nani Esther, and you were at Esther's house and what she did for you post-delivery and helping you with the tears because, yeah, I was a big baby. I was 10, 11. I still can't believe you birthed a child that big. But, you know.
Cousin Esther Byron, she came to pick me up with this driver. His name came last week and I said, your name have to stay. Mr. Scaramouche from Zion Hill. And they came with my brother and they came to meet me down at Mother Matron Atancia with this big pretty baby, skin clean, like I whistled some areas and all the peelings and stuff. And I got this baby and she'd watch me. And I only praying to go home, to reach home. She said, no, you're not going home. I am taking you by me. There is no one home to take care of you. Your brothers cannot. You know, I lost my mom when I was 16 and I had her when I was 22. So I was still young, like a Chinese pong. And, and she took me. And this woman gone through the time. So when I look, she already have all she bush. She bacano, all she dry bush, she have plum bush, and she have everything there waiting. And I was ripped, but matron didn't stitch me up. She said it will heal. And she told Esther and they talk. Esther knew what she knew because Esther, my big cousin Esther Byron. Esther Byron, I call in your name, may your soul rest in eternal peace. And my cousin Esther put me over a pail. I seen smoke coming out of the pail.
Yeah.
But she telling me, sit down.
So here's the thing, right? In the US and the UK, there's now people doing yoni steaming and so forth. And so when people come and they ask me about yoni steam, because unfortunately,
because I was ripped to bring this baby, come matron tell me, just give she the shoulders, just give she the head, and she will take the baby. So she, because I did give up, say I wasn't going to continue. I can't take this anymore. And she said, no, don't say you can't. We getting this baby. So the rip and the hot, smoky water with all them bush in it, with the healing properties, as I go down over it, I jump up, oh God, oh God, oh God. Because the steam catch the tear. You guys know that? And my cousin Esther Byron hold me down. She put a wet towel on my head and she band the head and she says, sit. So now and then she go raise me up when she see like a, oh, and my mouth can't close. She go raise me up and then she go say, go back down. That is treatment after I had my baby.
yes.
And
So,
I can feel lumps of things dropping out. If she didn't do that, what would have happened to me?
Yeah. So
just to say, Sydney and Cora, that's why we need to have. No, Esther's gone. She's gone with the with that information, and we need to document all of these things and have them for future generation. Because what you're saying there, I remember I've done something like that when I had my very first kid in Tobago. My auntie Brazil in Belgarden, she's still alive. She did say to my mom, tell her to do exactly what you're saying.
Yeah.
So I am aware of it, and they're all going, and we are losing very important rituals and good things with all the bush, which needs to be documented. Just that.
Now we have people who are called master herbalists and yoni steamers, and they're making a lot of money off of it. Certainly, I've been asking very many fora, what do you feel about yoni? So what I tell people is, I only know of it is in one context from our community, which is I know of it in the postpartum period. I know of very specific herbs used because Coco knows them, Joanne. She knows them.
Coco, you have to write. You and me together.
I really should.
Yes.
And so I said, I know of those. I don't know what I hear people doing about it, though. But the other thing is we've been seeing people in the U.S. and in England, and I do a room on Clubhouse every Saturday. And there have been a few people who've come on to share the burns. They've been scalded. Right? They've had burns. But it's also because it's been commercialized into something it was never intended to be. There are people doing it 3, 4, 5 times a month, every month now, almost like a douche, which is not how it works. There are people buying boric acid and putting it in their vagina. But I don't want to go away from the mental health thing here. So what I do want to emphasize is a lot of the mental health stuff that we're talking about, especially in girls, they show up in teens and early 20s. But as a community, so we know, for example, with bipolar during manic episodes, promiscuity can also be higher. Coco's heard my famous story of the patient I thought I healed on the psych ward when I was on my psych rotation. Because we bonded, and I can say the name she used because that wasn't her real name, but she called herself Mary. And it wasn't until after the final episode that I realized why she called herself Mary, because she had decided, right, this is where you can have those fixed days. She had decided based on the voices and the visitations. And I mean, when I say visitations, one day I was in her room sitting with her because she was always eager to talk with me every day. And I remember the psych nurse, Peter, because interestingly on the psych wards, a lot of the nurses are male. And Peter was like, she's playing you, right? She likes coming in because you take her stories and you're so excited and you write everything down. Because a lot of people with bipolar also experience what we call feelings of grandeur, right? And so someone coming in and writing down your story makes you feel great, powerful. That's sense of grandeur. Yeah, I was her reporter. And so she loved having me come in so she could tell me a story every day. And every day Mary had a story for me. And
don't listen, Mary. I said, woman.
Every day I wrote Mary's story, 3, 4, 5 pages. I would go type it up as well. She enjoyed that. And so 2 things happened. One, I was in Mary's room and we're talking and she said, I want you to know you've really helped me. These last few weeks have been amazing and you've changed who I am. And she said, do you see that at the window? That's God. He's come to tell me that you saved me. So I look and I was like, Mary, that's a bird. And she's like, no, he's talking to me right now. Do you not see him talking to me? Like, Mary, no, the bird's not even looking at us, right? Anyway, I left the room. And she called back for me about an hour later. I go back to the room and she's freshly showered. Her hair is washed. And she's like, I'm a new woman. I just want you to know. And I left and I came on and I was literally writing in the little caged area where they put the doctors and the medical students. And I was writing about the breakthrough because I was like, yes, maybe this is for me. Maybe I'm going to be a psychiatrist because I just cured a bipolar person. And just then Peter came to me and he said, your girl Mary is at it again. I said, what do you mean at it again? He said, we just found her in blah patient's room doing a certain thing to him. And I said, what? No, she doesn't do that stuff anymore. She's cured. And he said, you should probably go find her. So I go to her and I said, Mary, what happened? I thought you said, you had a breakthrough and the bird, it talked to you. And my mom laughed because I came home and said, in that moment, I realized Mary was actually bringing me over to her side and not the other way around. And and she started telling me everything she actually have always said, which that was in the moment I realized, Mary has fixed views. There's nothing I'm going to say to Mary that's going to change who Mary is. And yeah, that's right. So the reason why she calls herself Mary is because she is Jesus's mother, and she's here to heal people. And there's only one way she heals people, and she heals men through a certain act. And, she started telling me how she just healed the guy. And in that moment, I realized, so nothing I ever was going to say, do, or write about Mary was going to heal Mary, right? Because that's the thing. But so that's some of what we need to talk about in our community. I've watched certain people, their behaviors, that's where it's not, I just don't want the audience thinking that these diagnoses are made after one quick visit. They're not made after a 10-minute interaction.
They can play the game for you.
So what you need is to advocate for the community. We had Nurse Roberts on the show, and she talked about what she does for mental health in the community in Tobago. It's an ongoing thing, right? And so, for example, if your family member was inpatient in the psych ward and they come home, that doesn't mean they're now cured, guys. It doesn't mean that now you get to just say no more. It doesn't mean that the prayer was enough, right? So just because they came out and pastor prayed and they told you that life changed, the same way you don't stop being a diabetic just because you stop taking insulin. You don't stop having high blood pressure just because you don't need as much medication. You don't stop being a sex addict because you decided you're going to just have sex with one person. Mental health and mental illness is the same thing. And I have a feeling, unfortunately, there are a lot of people who they really want to believe a miracle and only a miracle can save them, because that shows a sign of superiority. I think they believe there's a superiority there if you can say you were cured. But mental illness is an ongoing thing. We have to identify it. Instead of saying a young person is promiscuous, a lot of promiscuity that you see in young people can go back either to being abused or there is some mental illness that's leading to certain behaviors. It's not enough to lock them in the house. It's not enough to call them names. You actually have to help them get strategies to deal with what's going on by getting the person to help them. I just talked forever. So I'm...
That's okay.
If you guys have questions for me...
You see, you just sanctioned whatever Dr. Earl Henry said, what Joanne said, and what Avenel said. And we are grateful for this because we don't have to wait now for clinical conversations. We already had it today, full blast. So,
Mama Coco?
Yes.
I would like to say every time Dr. Cindy opens her mouth, I learn so much.
Yes.
And sometimes I don't want her to stop because I learned so much. And especially when she discussed the physiological aspect of the brain, I learned so much because anatomy is one area that I'm interested in.
I have a reason I asked the question because there's a situation that I noticed and watched, and the areas in which that person was touching that other person in their head. My God.
Yes.
Daughter,
you don't know what you just did.
Yeah, no, the temporal lobe is really powerful because I said it's your memory center, right? So, for example, if somebody has a stroke, there are two types of strokes in particular we look at, and we look at two parts of the brain. One is called the Broca's region, and the other one is called the parietal lobe. The parietal region is actually right there in that temporal part of the brain. So that's the person who is going to have a stroke. They speak normal. They're going to say all sorts of amazing words. But if you listen to them speaking, you realize they're speaking a word salad. Because
slurred.
No, not slurred. Not slurred. Their speech is perfectly fine. It's just that they can no longer comprehend, right? And that's the same part again, the parietal part of the brain, which is right next to the temporal lobe, as opposed to the other part of the brain that we call Broca's area, which is what controls motor, how you speak. So that person is actually going to make sense when they speak, but they speak very slow and slurred, but they know what they're saying, right?
That's the Broca's region.
That's Broca's region. So it's actually important to know it because you can immediately tell. Because the other thing is the person with the Broca's is still going to remember you usually. They know who you are. And they're going to talk to you. The problem is it's just really hard for them to get words out. But they know exactly what they're talking about. And that's what I saw with our family member who had a stroke, which is why I told you nothing wrong with his memory. When you were like, you think you remember who we had? I said, no, it's clear he had a Broca's area stroke. Whereas the parietal stroke person, they're going to be talking to you. You're going to be like, what are they saying? And they won't really recognize you because the memory part of the brain, the hippocampal area, got damaged a little bit. And so they're going to say a lot of things. You also see it in an alcoholic who's actually ended up with brain damage.
But you know, that is the kind of stroke that we're suffering from in Tobago a lot, you know, the Broca's region stroke.
Yes, you see a lot of people with that slowing, and you see loss of motor function. You see their arm, the paralysis, and all that stuff. Yeah, that's a motor function, and it affects a special thing called a homunculus, which is like a drawing of a man on the brain, and you can tell what region.
And that's one of the therapy that I really learned to do, you know, the range of motion. A lot of people lost their range of motion. Yeah?
Oh, yeah, so that's one of the things. But really, I think for me, and you have Dr. Faith coming on, and she studied neuroscience. I think, I haven't heard it yet, but I really, you know, here in the United States, in really top-notch magnet schools and so on in high schools, they now teach early neuroscience in order to help kids understand computer science. They teach neuroscience and computer science starting around age 13, 14. I do think one way to advance the educational system home and to also start bringing about better understanding of mental health is to also actually start introducing some concepts of neuroscience at the pre-college level, right? And, you know, there was a time when we did social studies, integrated science. We still need all that. But the world is such now that neuroscience cannot just be something you elect to learn if you go to college, right? We know more about the brain now than we ever did before. There's even something now we know called neuroplasticity, which is the ability for the brain to heal itself, to renew itself. The ability for people to regain memories, the ability to help slow memory loss and dementia, etc. And those things need to be brought into our curriculum, I think, in Trinidad and Tobago now more than ever. Certainly, the understanding of neuroplasticity is why we now understand you could teach someone with Down syndrome. You don't just say they're this or that. You can teach someone with Asperger's, someone with autism, and help them be functional because we understand neuroplasticity. And so I think the basics of neuroscience needs to be part of education if you're going to help people also understand to destigmatize mental illness, right? Again, why is it that if somebody has an illness in the brain, it's a taboo, but if the illness is the pancreas, we're more likely to address it. If the illness is with their heart, we definitely want to address it, right? If somebody has a bad foot, we want to address it. The brain is an organ as well, and it's the most central.
I said it in.
I think it's because. I think it's. Sorry.
Let's have Earl speak first, Coco.
No, yeah. I think it's because of the behavior that accompanies brain related issues. There's a behavior, people behave a certain way. When people have a heart disease or they have diabetes, that doesn't really affect their behavior per se. They're the same person. But when they have a brain problem, they behave different, strange. People wondering if they're mad, if they're crazy. You know, back home, he crazy. What happened to she, boy? Is she going mad?
Yeah.
You know, I think that's the difference.
Right? We use crazy to curse. You look at the classic Trinbagonian cuss out and somebody calls somebody crazy, somebody just say you're mad in your shad, you know, like the Trinbagonian cuss out includes actual accusations about mental health. If we watch, I don't know how much extempo happens now, but I know when I was growing up, extempo was a big deal. And even in my high school, that was one of our ways we used to pass time during free periods is we'll have extempo.
Well, you know? Yeah. You are in Tobago.
The talk and the joke.
Yeah. Yes,
in Tobago, we say, watch out. You see how they you're not good there?
Yeah, you know.
You're not good, watch out. You see, I go up there, Cashew Street, you're not good.
That's the mistake that people made with me. So that right now they can't believe that this lady knows so much about them because they allow me into their space because they dismiss me. Hello?
Amen.
I think we've got to, you know, we have to look at it as a community and ask, what can we do different? What can we do to change the future? We may not be able to teach the 70-year-old, the 50-year-old neuroscience and neuroplasticity, although I argue we can. But if you're going to actually invest, you want to invest in making sure the younger generation really gets what neuroscience is, right? Donette is saying, Dr. Duke, in our culture, it's often linked to obia instead of addressing the issues. Yeah. And, you know, so first of all, it's an interesting thing, right? Because obia is actually a religion, but it was also vilified in colonial times because it was necessary to take power from the enslaved. So it was turned into this evil, this dark magic that now you get to keep using the language as dark magic. So if somebody is harmed, they do them obia as opposed to saying, let me go get them the help they need.
Because you see in the day of obia, everybody use it because it was the cheapest way to try to heal somebody.
Right. Well, it wasn't just it's culturally, it's who they knew as their healers, right? Yes. Those were the healers that came across, and if they weren't the healer themselves, they were employing healing things that they learned before they were captured or enslaved, right? So that's part of that. And so that's the thing. But I agree with Donette in that a lot of people just chalk up curable things to obia. We literally,
I want you to emphasize on this area of bipolar and your child going to school. Your daughter just tell you see your daughter, she's not doing good in school. She complaining of this stupidness that she come home telling you. It's not stupidness, but it's real and it's a medical thing. But you believe somebody takes your book and this makes you get a headache.
Let's go back to the PMDD, right? 2 weeks out of every month, your daughter is really just, she's lethargic. She doesn't want to go to school. The teacher tells you that, I don't know what's wrong with she and her. Sometimes she's good, but other times she's just out of it. She's telling you she can't think straight. And you are there saying it's the neighbor, it's the person who took her book, it's the teacher that's trying to cheat her of her education. Instead, your daughter's struggling with PMDD, but now she's been told that the neighbor to do her. So for the rest of her life, instead of getting the help for her PMDD, which is actually a very straightforward thing we can do as gynecologists and primary care doctors and GPs many times, she's not getting any of that help because she's now bought into this belief that for the rest of her menstrual life, she's been tormented by the neighbor. So even the neighbor dies. And she is still cursed for the rest of her life because the neighbor died and she never freed me from the curse or the obia or the whatever she had put on me, right? And so we do need to talk about it because PMDD impacts a lot.
Adult are we seeing now because of that in Tobago or even in America, because some people bring the same belief. Somebody to me in America where they will go to places to get help and heal, destroying themselves and others in the meanwhile, because you going to all these psychic and these seer people and these seer man here in Chinatown and all over the place, giving people a whole lot of crap to hold on to, leaving them without knowing that, hey, I came to America to do something, to be a doctor. to be a psychiatrist, to be whatever, but somebody do me from since then, and the neighbor is dead. Doctor,
it's easier to explain that as opposed to sitting down and actually writing it down and realizing there's a pattern, right? Which is, oh my goodness, this happens, and then 2 weeks later I have my period. Or if you want to judge it from the period, 2 weeks after my period, this thing always happens to me, or the week before my period, It's always amazing to me that I can talk to someone in her 30s and bring her that clarity within a 30-minute visit by just helping her connect the dots and help her realize that for the last 25, 30 years for some of them, because, people having periods younger and younger, the average age of first period for a Black child is age 8. So you're looking at having periods for a long time. So imagine having periods so painful every month that you were missing time from school. You meet your partner and you're having pain a certain time of every month, and he decides you're just plain hard to get, but you're really in pain. And there are things people can do to help you, but nobody's talking to you about it because maybe they told you all you need to do is have a baby. All you need to do is this, that. And so you're chasing solutions that aren't actually addressing the underlying thing. Some people, then it leads to infertility. And so now that's a whole different thing. They're telling you have a baby. You've been trying, but the baby's not coming. So now you're deciding, did you again, right? Another person, because people can tell you things. Yeah, somebody can tell you you're going to eat from a garbage can. That doesn't mean you're now destined to eat from a garbage can, But that's when you give too much power to people's words. But anyway, that's not my purview, so I'm not going to go into that. But I feel like that's a lot of what happens and a lot of the excuses given. But as a community, we have to look at what we have going on and really address the issue, which is, one, you got to hold your leadership accountable, right? It's not enough to watch politicians use the same tropes, which is they use words like crazy, head no good, etc. Because if they can say that of their opponent, they're going to say it of you if you disagree with their policies instead of helping the community. You can't just look. Oh, yes, go ahead, Earl.
No. Sorry, I thought you were finished. Go ahead.
Yeah, go ahead.
No, you used the word hug earlier on. We have to hug people with mental health issues literally and figuratively. Mm-hmm. And I think you made that point. Another takeaway I got from you is that we say faith without works is dead. Prayer without works
also
is dead.
Yeah.
So we have to pray for a person if that person has mental health issues, but we also have to take them to get some mental health counseling or see the psychiatrist or take your medication and do what you have to do while we're praying. So those two are the takeaways I got from your presentation. And thank you, Dr. Cindy. Every time you talk, I am just in awe. The Trinidadian would say, she not easy. No, the Trinidadian would say, she ain't easy. The Tobago would say, she not easy.
Yeah.
She not easy. Cindy, thank you. I have learned so much from your presentation. Always. Thank you. I appreciate you.
We will continue this next week. This is a rollover. But before we move away, Dr. Duke, I think you have to come back. There's a stressing question that we're going to take from this onto next week is about men's ability to seek help medically.
Yeah. Well, that's a really good point because mental health.
Dr. Earl came here was to help me on that topic. He will help me next week, but we have to start it now before we do.
Well, I think, we'll have Earl weigh in, but I would say one of the biggest challenges, as if it's not enough taboo in our culture, not to talk about mental health. Mental health for men in a machismo culture is absolutely not discussed. Because the first issue is, so what does machismo mean? It's that hyper masculine expectation that we have for men, right? We expect that men shouldn't cry. We expect that men shouldn't have feelings of hurt. we expect that men cannot confess to being fearful or anxious about things. And that's really part of what we call hypermasculinity, toxic masculinity. And so toxic masculinity, you couple that with someone having mental illness and you're leaving them really vulnerable, right? You're leaving them lost because they can't even come in and say to someone, I'm struggling, because they're afraid that even their healthcare professional is going to judge them as having failed as a man, right?
So do you think a man experiencing impotency is something mental also?
Well, there's psychological aspects to impotency or sexual dysfunction for men and women, right? In fact, for women, a woman doesn't actually experience sexual pleasure if she's not psychologically a part of it, right? She has to psychologically be turned on to actually experience pleasure. For a guy, while physiology drives a big part of it, it can also be impacted by mental illness. But here's the other kicker, right? Some of our mental health medications can literally cut libido. It can cut sexual desire. And so that's another thing wherein literally we have patients who, particularly those who have like schizophrenia and manic prominent bipolar, who will actually discontinue their psychiatric medication because it's impacted their sexual function. So you literally, and I've had patients where their partner agreed to it because the partner's like, we have no sex life when he's on his meds. But of course, he comes off his meds, the sex is going to be great for 2 to 3 weeks at most, but then his other issue is going to start being an issue again, which is his mania or his psychosis or his delusional state that comes from his psychosis. And so again, it becomes important, so as a fertility specialist, sexual health specialist, I have written to psychiatrists on behalf of patients, letting the psychiatrists know that this particular medication is negatively impacting their sexual function. Can we consider some alternatives? While I'm not a psychiatric professional, I did spend a lot of time studying psychiatry. And Coco, I spent extra time on the psych wards because as an MD PhD student, I had that extra 4 years. I could choose anything I wanted to focus in on. So I focused in more on neurology and psychiatry because I love the two of them. But as you know, in the end, I didn't choose them because you don't do a lot of surgery and I like using my hands. But because I got to look into that, I'm able to actually write to people and say, hey, this person's sexual function is impacted. I mean, literally, right? We have people for whom, if they're so depressed, there's no interest in sex, right? There's zero interest. And interest does play a role in arousal. It plays a role in maintaining arousal, right? Which when you're asking about erectile dysfunction, that's part of it. It's not just getting it up, it's keeping it up, right?
My goodness. So, doctor, are you saying that sex is an integral part of keeping relationships or keeping marriages or having sanity expressed all over your house?
I don't think it's a requirement per se, but I think it's a big part of the relationship. Most people wouldn't get married if that wasn't part of the expectation of the contract, right? You could just be friends. You know what I mean? And so, there's the rap song from the 90s, OPP, right? Many people get married because they do get some access to OPP, right? And so there's, oh yeah, Coco, we're going to talk about that. We're going to have to introduce you to some rap lyrics.
Avanell don't know nothing about OPP.
What do we do?
Joanne, you know about OPP?
I think
I know.
Um,
Done with OPP.
Yeah,
Should I say what it means, Dr. Cindy?
Sure, if you
go ahead.
like for Coco.
Other people's property.
Yeah. Okay.
Oh, okay.
Who's done with OPP? You know me. Who's done with OPP?
Coco, Earl heard the clean version. You can exchange the second P, Earl, for any other P you're thinking of sexual function.
Yeah.
Yeah.
You mean something else still?
Yeah, so instead of own personal property, because that's the clean version, you change property to any other P word you're thinking.
Yeah, right.
Male or female, yeah.
Oh boy.
Yeah.
And gentlemen, we're gonna have a couple of questions from the audience there. Avanell Beard Lewis, she's here. What's she saying here now?
CJ Beard Lewis says, just yesterday, that was a discussion among my sisters and I.
OPP, CJ, you were talking about OPP yesterday?
No.
Good.
After you see what Sydney? Well, ladies and
Dr. Cindy.
CJ is one of the pastors that I asked to be with me next week. I don't know if she's going to comply. If not, it's okay. But then as we speak here now, let us get some of her questions here.
Yes, CJ Beard Lewis is saying, definitely so. These medications really negatively impact patients, male and female, sexually. I experienced that with close members from my community back home.
Yeah, no, it's a big deal. And we need to address it, right? Because if someone doesn't feel like they can function sexually, especially in a society where sexual function, especially for men, it's a big deal, right? You know, there are literally people who would watch a guy, and if he's with a woman and he hasn't gotten her pregnant, oh, the blue boat's coming for you, did this coming for you?
The blue boat was the word that used to me many times until I get pregnant with you.
Yeah, so, you know, that there's a lot that people have to start fixing. When we really want to address it, we have to change our language, right? That's the education piece again, as Earl and Joanne and Avenel was saying. We got to start changing even the way we approach language, the way we approach our vernacular, our teasing of people, right? You know, the fact that it landed in the House of the Tobago's legislature where one person was making jokes, teasing one person about whether they've ever really enjoyed sex, you know, I don't know if you ever felt sweetness. It shows you, again, like I said, it's a classic part of the Tobago, especially the Tobago cuss, crazy and sexual prowess. It comes up in the cuss out.
The way you can breed a mule.
You know, and so.
Shooting blanks.
Yeah.
Hard.
Yeah, so that language does have to change if we're actually going to help people.
Listen, until as you reach home now, young people gonna meet you. Let me see your hand there. You not married?
Yeah.
You're not married? What is this?
And Cindy, I kind of want to touch something too when it comes to like the diagnosis and the medications we give as health professionals. One thing to note is that antidepressants can also trigger bipolar disorders.
Right. So, well, not necessarily trigger, but if it's not diagnosed, right? So, for example, whenever we give an antidepressant, usually...
Dr. Duke, see, you put something there for you right now.
Yeah, they call it the unit vote, which is true. Yeah, you know, it's true.
Those are the words that get me, because everybody was telling Winston Duke, the father of my children, they should tell him, why do you not both come for you, you know? You're not breeder one year yet? And that used to make me feel as if, well...
like you're failing him.
Oh my God.
Which is also crazy, right? You know, Mary Day said the other one is goat bite you. Yeah.
And leave it teeth.
Yeah. So, you know, I mean, they're funny, but the truth is...
when I did get pregnant now, this boy from Speyside used to pass up every evening from work. Who bet the cat? Who bet the cat?
You know, so lots of things we need to address because people aren't willing to talk about things if that's what's going to happen, right? They're not willing to admit they need help if that's what's going to happen. Mary Dates is saying certain mental health medication can also heighten sexual desire. So that ties in with what Avi was saying. So, for example, if you, as a mental health professional, haven't actually realized that the person you're dealing with isn't just depressed, but also has had bouts of mania, you could actually exacerbate bipolar by giving them an antidepressant. Because the whole purpose of an antidepressant is to increase a certain neurotransmitter, or what I call a hormone, as a reproductive endocrinologist, called serotonin. You're supposed to increase serotonin's availability in their brain. However, increased serotonin is exactly what happens during mania. So if this person is actually bipolar, but you're catching them right now while they're on a depressive episode, and you didn't actually get a good history from them to realize that they've had a manic episode before a manic break, when you put them on an antidepressant, you're going to put them into a manic state. And with mania does come, as in this, what Mary's talking about, come heightened sexual desires. Because like I said again, that's what happens with mania. You know, during the manic episodes, you're motivated for everything. You're motivated for everything. You're also going to enjoy sexual interactions more. In fact, it's been studied, it's been documented, a manic person will say they have the best orgasms during their mania, right? And so that's why they come off their meds if you put them on for the mania.
I know you will go on with this because this one is deep, but explain to us what's dopamine.
So dopamine is another neurotransmitter made in the brain that also has similar properties and part of that conversation. So there are a number of neurotransmitters. We have dopamine, serotonin, norepinephrine, we've got GABA. We have a number of these neurotransmitters that have to be balanced, right? They have to crosstalk, but there needs to be a balance. And so the person who is prescribing things, literally that's what you're doing. You're prescribing to tweak one up or down while you level out another. And so you got to know what you're leveling. Nowadays, we have medicine that can even treat that addiction center I talked about, the locus coeruleus. It can block dopamine, but we have a couple. So there's one called Buspar or Buspirone. It can address that. We have others like Wellbutrin that can even affect the craving, right, that people have for smoking. You know, that craving, like I need to hold a cigarette in my hand. I need to bring something back and forth to my mouth. That craving, we literally have medicines now that target the part of the brain that controls that craving. Now,
like the taste of cigarette.
Yeah, there are people who the taste, but not only that, right? There are literally people who would tell you the reason why they smoke is because it's the only time they can think.
Yes.
Yeah. So not only do you maybe think of medicines, but you're going to think of different, what I call behavioral changes, or what we call CBT, right? Cognitive behavioral therapy. To help them come up with new. So maybe, okay, if the act of moving things back and forth to your mouth is what helps you think, we come up with snacks and different things you can think. If nicotine, because nicotine gives a high and it helps people concentrate. It's why a lot of teenagers and college students abuse nicotine gum when they're studying in college, because you can really focus, you can really concentrate, right? You'd see them take those gums before a test because it helps them focus on the test, right? And so again, you have to start asking, what is this person, you know, because you're going to hear, like I said, right, a smoker is going to tell you, I do my best thinking when I smoke, which tells you the nicotine is really what they're craving. So maybe that's the person I'm going to offer a patch to. That's the person I'm going to offer a gum to, the nicotine gum, because I'm realizing it's the nicotine that they need.
Or you offer them, would you offer them an e-cigarette, the one that doesn't have any?
A vape? So the vaping one is actually misinformation. Vaping has similar negative impacts on the lungs, risk of lung cancer. Certainly we saw before the pandemic, the big issue with vaping that led to a lot of young people having lung damage and needing lung transplants. So vaping isn't the solution that people thought it was at all. It's not. But again, if I'm working with someone to help them curb an addiction, etc., that's what we do. There's even, I know Trinidad and Tobago doesn't have this yet, but now we actually have rapid detox. There are special things that can be done where you put someone under anesthesia and they put them through rapid detoxification based on what they're addicted to. They wake up 16 hours later and they're clean. They've gone through all the withdrawal, everything else, right?
Well, Dr. Duke, I'm going to have to thank you very heartily and heartily for your contributions today. I'm so happy that you joined at the time you did, saving Dr. Earl Henry from giving his profession the test that I wanted.